Good morning, everyone.
Good morning.
I'm Kathy Deeringer, President of the National Athletic Trainers Association. I am delighted to moderate and participate in our National Media Forum today, celebrating Title IX and women in healthcare. This is our chance to look back at where we've been, where we are today, and where we still have to go. As you know, Title IX is the law that forbids sex-based discrimination in educational programming and activities receiving federal funding. It was originally known as a means to ensure equal funding for women's sports, but we of course now know the impact that Title IX has had on education and job opportunities for women. This is an extraordinary week for us as we host our 73rd Clinical Symposia here in Philadelphia. And as we recognize Title IX's 50th anniversary on June 23rd, just a few days ago. Perhaps as you entered the Pennsylvania Convention Center, you saw our Title IX exhibit or attended an earlier session today featuring NATA's first two female presidents, one whose athletic participation was impacted by the passing of Title IX, and the other whose work opportunities expanded given the increase in female sports teams and her role as an athletic trainer. To be honest, I was 12 when Title IX was passed. When I entered high school, I had opportunities afforded to me. I had the opportunity to play whatever sport I wanted to. I was not aware of inequities that might have existed. I felt the impact of Title IX in the increased opportunities to work as an athletic trainer in women's sports, as well as in education and in leadership roles in the profession. Yet it took more than 25 years for a professional sports league to hire a woman as an athletic trainer. That was in 2002. That was Eriko Iso with the Pittsburgh Steelers. Since that time, there has clearly been progress in other leagues, but inequities still remain. We are delighted to share the stage with esteemed and leading representatives of allied sport and health associations this morning. Many of you have indicated that you were competitive athletes, 3 of you in swimming, 1 of you in softball, and 1 in gymnastics. I know others of you were impacted in your education and your professional roles. Our agenda today includes time for us to delve into this deeper and ask and answer questions about Title IX. We will also unveil the results of a survey on the topic addressing gender issues and workplace safety conducted among our allied health organizations, from which we received 2,000 responses. We have much to cover, but first let me introduce to you our distinguished panel who are joining us here in the Pennsylvania Convention Center as well as virtually. We have with us here on site, Kristen Bellison, Chief Executive Officer of the American College of Sports Medicine, Dr. Jill Tyne Nissenbaum, Treasurer of the American Physical Therapy Association's Academy of Sports Physical Therapy, Dr. Sheila Ward, Board Member of the Black Women in Sport Foundation based here in Philadelphia, LeGwen Durden-Hookham, Director of Sports Medicine of the National Collegiate Athletic Association's Sports Science Institute. Virtually, we have Dr. Mary Lloyd Ireland, Fellow of the American Academy of Orthopedic Surgeons, Dr. Michelle Labatz, Board Member of the Maine Chapter of the American Academy of Pediatrics, Dr. Jennifer Orozco, President and Chair of the Board of the American Academy of Physician Associates, Dr. Sandra Schneider, Senior Vice President of Clinical Affairs at the American College of Emergency Physicians, Dr. Amy Powell, Immediate Past President of the American Medical Society for Sports Medicine, Dr. Becca Rodriguez Regner, Immediate Past President of the American Osteopathic Academy of Sports Medicine, Dr. George Champias, Chief Medical Officer of the U.S. Soccer Federation, Sarah Axelson, Vice President of Advocacy at the Women's Sports Foundation. Thank you all for joining us, and let's get right to our questions. We have 4 key questions to ask, and with our large group today, we'll make sure each of you get to address 2 of them. The first question, how has Title IX impacted you or your organization or profession? And we'll start with Dr. Ireland.
Thank you for this opportunity, and I'm representing the American Academy of Orthopedic Surgeons, which is only 6% of orthopedic surgeons are females. We must change that. I was an athlete, a baby boomer class, high school class of 1970. So I was not directly affected by Title IX for scholarships and that activity, but as a swimmer, I really wanted to continue to swim, and it justified my need to continue swimming in college, which kept me focused and organized to do the best in college as I could, and also med school. So I quit swimming at age 25. I don't know if anybody remembers AIAW, but at Memphis State, I competed in the AIAW pre-NCAA. Sports enabled and empowered me. I knew I could be successful because I was successful in sports. And most orthopedists now who are female of the next generation, 45 or less, have been in sports. And they state that if they were not in sports, they would not be in orthopedics. As an orthopedic surgeon, certainly access to more female athletes. We know that in high school, over 10-fold increase over 50 years in female participation. So it has really helped us as having a pipeline of female athletes, both high school, college, and now professional athletes to take care of. And our academy is emphasizing improving the diverse numbers, and we have grants to allow more females to think they can become orthopedists. We only have one female who was the president of AAOS and one female for AOSSM. So we've got a lot to do, but sports empowered me to be where I am today, and I thank you.
Thank you, Dr. Ireland. Kristen?
Thank you. As a collegiate athlete, as a swimmer as well. Hi, Dr. Ireland. Nice to see you. I had the opportunity to start swimming when I was 7 years old, but went to college 93 to 97. So Title IX was in effect and working for us. I continue to see the changes that have occurred from the time that I graduated college and finished swimming at the University of Iowa. But I think the biggest opportunity is for me as a female is to be an ally and accomplice to help other females in this particular situation. And I think the thing that we do as an organization at ACSM is involve females and people of color and inclusiveness at all points and really try to focus on that.
Thank you. Dr. Rodriguez-Regner. I think you're still muted.
Sorry, thanks. Thanks so much for NATA for having me on the panel. So Title IX has affected me by giving me the chance and the opportunity to have equal play and also scholarship award as a college cheerleader. So as you know, there are both male and female people on the team. And so it was just great to see that opportunity and those funds were available to both the females and the males participating. When I went to college at Grand Canyon University, go Lopes. And I think it's a kind of a three-part question for me as team physician. Title IX has also affected me by giving me the access to learn from an equal number of like male to female athletes in collegiate, professional, and Olympic sports. And this was definitely during training and education, but as well as now in clinical practice. So as for the American Osteopathic Academy of Sports Medicine, I believe that Title IX has also opened the doors for acceptance and the number of female professionals that we have. It continues to grow. So that's super exciting to see many students, female students, interested in medicine and really wanted to take care of athletes. This is a great advantage because, again, I feel as a female team physician, we bring many traits to the table in order to help all our athletes.
Thank you. Dr. Ward.
Yes, my name is Dr. Ward, and I am a board member and chair for Black Women in Sport Foundation, whose mission is to increase the involvement of girls in all aspects of sports. And that's from the playground to the Olympics, to the boardroom, to coaching, all aspects. It includes health. And so while we recognize that Title IX has definitely increased facilities and participation. We also recognize that some of our African-American leaders, when Title IX was being formed, they had some issues with it. We can look to Shirley Chisholm and Charles Diggs because they noticed that it concerned gender. It did not take into consideration the intersection of gender and race. And we need to recognize that. We need to recognize the roles that historically Black colleges and universities play. I am a professor at Norfolk State University, one of the largest historically Black colleges and universities in the country. I am in the Department of Health, Physical Education, and Exercise Science. So many of my students are athletes or they want to be in the sports medicine field. And so we need to make sure that they are going to be welcome when it is time for them to get jobs, and that it is going to be a fair assessment of their skills, and that they will be able to get jobs in leadership positions. And so between Black Women in Sports Foundation, making sure that all girls have access to every aspect of sport and teaching at an HBCU, we can really deal with lived experiences in dealing with equity in terms of sports as well as health.
Thank you. LaGwen?
Oh, sorry. Wasn't sure if my voice would carry. Thank you, Kathy and NATA for inviting me to participate in this discussion. When I think about the impact on me personally that Title IX has had, it's about the bigger picture, the pathway to opportunities in higher education and a college degree. Title IX covers 10 areas, but the discussion around it usually centers on athletics. And Title IX required athletics departments to equitably provide scholarships and opportunities for participation, but also equitable treatment and benefits, things like facilities and travel, academic and medical support. That's one way it's impacted me professionally, athletic trainers on our campuses. NC2A supports the membership in creating policies, resources and education for creating an understanding on the laws that impact our student athletes directly. We've seen participation rates improve. We've seen diversity with our female student athletes increase, and resources across all divisions has grown. Obviously, there are gaps and opportunities for improving, but I'm hopeful that in the era of change that the NC2A is now in, that we are carrying forward the values of Title IX. The new Constitution includes the principles around gender equity and diversity, equity, and inclusion, and also student athlete well-being.
Thank you, LaGwen. Sarah?
Thank you, and thank you so much for the opportunity to have this conversation today. Sarah Axelson, I'm Vice President of Advocacy with the Women's Sports Foundation, and we're a national nonprofit founded by Billie Jean King in 1974. So we really, it's been a busy June for us given the 50th anniversary, but we live and breathe Title IX every day of the year and every year. So this is a really important opportunity for us to reinvigorate the fight, because we know that we haven't achieved true equity yet. Personally, I played sports my whole life. I grew up playing softball and was fortunate to have the opportunity to play in college as well. And I'm, born post Title IX, and I saw my own share of inequities on the field. So we know that there's still plenty more work to be done. And as Dr. Ward mentioned, the research shows us the primary beneficiaries of Title IX have been suburban white girls. And so really making sure that we use this anniversary to re-energize and rededicate ourselves to the fight, to make sure that as we talk about Title IX and Title IX compliance, we really are centering those who have thus far been left behind by the law. That's girls of color, girls in urban and rural settings, girls with disabilities, making sure that all kids have access to sport, because we know the benefits that sport provide. Prior to the passage of Title IX, girls in high school had just under 300,000 opportunities to participate and just under 30,000 opportunities to participate in college. Those numbers have skyrocketed. We now see 3.4 million girls at the high school level having opportunities to play sports, but there's still over a million participation opportunity gap between girls and boys. And girls today still have not surpassed the level of participation opportunities provided to boys before Title IX was passed. So while we've made great progress, we know that there is so much work that needs to be done. And that's what the Women's Sports Foundation is focused on.
Thank you. So our next question is, in your opinion, what are the current unique challenges that face healthcare in athletics today? And as a follow-up, have you or your organization done anything specific to address that global concern? We're going to start with Dr. Labatz.
Oh, good morning. Thank you for the opportunity and the fabulous question. That is a great question with a lot of real estate. And so I'll be interested to hear what my peers have to say. But I will say over the past 20 years that I've been in this field, the issue that I've seen kind of slowly evolving, but then really exploding in the past 2 years have been issues related to mental health in athletes and really in the child and adolescent population at large. That is our new pandemic, truly, in the pediatric population. And I'm a huge proponent that the right sports experience can be very protective for mental health. But there are a lot of athletes that experience have adverse experiences as part of sport that really have mental health consequences, not only in real time, but over the long term and potentially lifelong. And these might include issues related to discrimination or maltreatment in sport, the way we treat or fail to treat concussion, training volume, burnout, early sports specialization. I see Amy kind of nodding a little bit there. And even size and shape pressures in athletes, right? Towards the big for the power athletes and towards the smaller for more of our females or those involved in aesthetic sports. I would say that pediatric sports medicine, actually sports medicine at large, has been doing a great job at trying to kind of identify what those protective factors are in terms of mental health and where those issues that are particularly problematic. Lots of research coming out, lots of publications that are coming out. We're doing our best to try to kind of spread the word, but the real challenge is going to be the dissemination and the implementation on the athletic fields, particularly down into the high school and the youth sports that at least day in and day out, I am finding that the messaging that we're trying so hard to put forward is not going through. And so I think that's a big challenge. And I'm looking forward to all of this working together on taking those next steps.
Thank you. Dr. Orozco?
Hi, good morning. Thank you so much. I'm Jen Orozco, President and Chair of the American Academy of Physician Associates. What Dr. Labatz said just very much resonated because that is, I think, one of, if not the top focus in athletics and healthcare today. All of us in healthcare I practice vascular surgery and I'm the director of advanced practice at a large academic center in Chicago. And all of us were tremendously affected by the pandemic. And I know the 400 employees that report up to me were very affected mentally, and their overall well-being was very, very difficult post-pandemic. And I think what we've seen is this big focus in healthcare shift to mental health and well-being, not only for our healthcare workforce, but also how that translates in athletics. I grew up a gymnast, and I grew up a gymnast in the old era of coaching. And that has affected me tremendously throughout my career and 20 years of practice in terms of self-worth and all of those things. From an AAPA perspective, this has really become our focus. I had a chance to interview, most of you probably know Simone Biles and Jane Pauley. We just had our conference with them and the focus was mental health. And I resonated with her as a gymnast and what she went through and all of those things that she experienced, because I experienced the same things, but this was a long time ago and you didn't talk about that. And so now really what our goal is to get people saying it's okay not to be okay. We have a really unique opportunity. We've partnered with the NFL and the Indianapolis Colts, who have been ahead of this in mental health with the Kick the Stigma campaign, which is really outside some traditional NFL approaches, and they've really embraced this as an organization, and we've really been lucky to partner with them, and we are working with their Kick the Stigma campaign to train many PAs, over 2,000 PAs in the state of Indiana. That's where we're going to start, and the hope is that we will not only start in Indiana, and then it will be train the trainer, and we will expand this to all the states and other organizations to really have this focus on mental health. And I agree with Dr. Labatz. This is something we have to address in our youth, not only in sports and in athletes, but we have to get everybody saying it's okay not to be okay, because people are still not seeking mental health. We still have increased rates of suicide, as well as anxiety and depression at crisis levels. And this is what we need to continue to focus on from a healthcare perspective.
No question. Thank you. Dr. Schneider.
Hi, I'm Sandy Schneider. I'm an emergency physician, as well as my post at the American College of Emergency Physicians. And I want to mention, I'm an emergency physician probably because of Title IX, because the year I started medical school was the year they finally started taking women on an equal basis, although it wasn't quite equal, but at least they took women. I absolutely agree with what Dr. Labatz and others have said about mental health. And certainly the American College of Emergency Physicians is doing a lot in that. But I want to try to turn the focus slightly to two other areas that I think not nearly as crucial, but certainly need our attention. One is the management of pain. We need new and better ways to handle pain other than simply giving pain pills and pain medications, particularly opioids. And we've learned so much about this, and our members have been so active in trying to find alternatives to opioids. And we even have legislation now codifying our need to use something other than opioids. We need to understand how opioids affect women as opposed to men. Men and women are not exactly the same. There's more that's different about us than just our gender and the organs that are slightly different. We think differently, we act differently, we have different physiology. Another area that I think we need to pay attention to is concussion. This is an area where emergency physicians see a lot of athletes, a lot of non-athletes who come in with varying ideas about what concussion is. And we're only really, I think, beginning to understand the science of concussion and really have great tests for that, and really understand what the individual is going to expect from the concussion as opposed to sort of concussion in general. I think we need more of that sort of personalized medicine, or precision medicine, as they've been calling it, to go to areas around brain injury and those types of things. ACEP has been extremely active in educating our members, obviously, but also providing them with information that they can give to our patients. And then I have to mention the research that our members are doing and others in the medical field. One of the reasons I love science and medicine is because we never really know the answer. It's because we never get to the final thing. And I think that can be confusing sometimes to the public. What do you mean you don't know? Well, the answer is we're probably just, someone told me we're always 2 questions away from the end of our knowledge. And I think sometimes in medicine, it's 1 question. So thank you very much for this opportunity.
Thank you. Dr. Powell.
Good morning. Thanks for the opportunity to be here, and hi to everybody who's in person at NATA in Philadelphia. We miss you all. So I wanted to just add, and I completely agree with what everyone else has said so far. On the mental health topic, I absolutely agree that that's kind of the new pandemic in sport. And I think the 2 things that are probably the most important right now for us collectively to work on. Number 1 is destigmatizing mental health in athletes. We know that our collegiate athletes at least have experienced mental health issues at the same rate as the general population. So it's not like, I agree with Dr. Labatz, it's not like everybody is protected. There's a dose-related response to exercise, right? But there are some things that are positive and some things that could be negative. But we need to understand that probably 30% of college athletes are going to experience a mental health problem during their time in college. So destigmatizing, I think, is really important. The second thing is a team-based approach, which I think we're all learning more and more about. So the working group of our teen physicians, athletic training colleagues, and mental health professionals coming together collectively to help athletes, I think, is really important. And I think a lot of organizations have demonstrated that. The one other thing that I wanted to bring up is trust. And I think that there have obviously been very public instances that Dr. Orozco referenced regarding teen physicians in particular causing heinous damage to athletes. And I worry about our athletes not, in certain circumstances, not recognizing that we always are there with their best interests in mind. So I think that we need to work on recreating and hopefully continuing a culture of trust as part of repairing the damage that particularly the gymnastics scandal has created, but there are others as well.
Thank you. Dr. Tyne Nissenbaum.
Good morning, everybody. My name is Jill Tyne Nissenbaum, and I'm representing the American Physical Therapy Association, particularly the American Academy of Sports Physical Therapy, which is a subset of the APTA. I appreciate all this conversation about mental health. I think that is incredibly important. I think one of the aspects that we can use to improve an individual's mental health is accessibility to sports and exercise throughout the lifespan. We know that females discontinue sport participation at a younger age than males. The average female discontinues sports at age 12, whereas a male will discontinue sport participation at age 14. We don't want to see these girls discontinuing sport or engaging in sport or activity, which can lead to this cascade of mental health, stress, anxiety, and of course, obesity. So we want to make sure that these girls engage in physical activity. They find an activity they love, whether it's recreational or competitive, and something that they can do throughout their lifespan. A few things that the Sports Academy has done to focus on this is we have created 2 special interest groups. We have one, the Female Athlete Special Interest Group, which really focuses heavily on all things female across the lifespan, from the adolescent athlete to the adult athlete, to the postpartum athlete, which I think we can agree if we've had children, we all are, to the master's athlete. And the role of that academy is to educate not only professionals, but consumers about the unique needs of the female athlete. The other SIG, or special interest group, that we have is the Youth Athlete SIG. And one of the roles of that SIG is to also identify the unique characteristics of working with the youth athlete. We want to make sure that they have an environment where they are safe and can participate in sport. We focus on sport specialization. How can we overcome some of these variables? We want to make sure that individuals, the female, the youth, start sports participation and then are able to successfully continue it throughout their lifespan and use exercise and physical activity as a way to maintain overall health, whether it's physical or, as we've talked about, mental.
Thank you so much. Dr. Champus.
Good morning, everyone. It's obviously an honor to be representing U.S. Soccer here at this incredible meeting at the NATA. It's not lost on me that I may look like a little different from everyone else and may be representing a separate population. But I think, when I looked at the survey, I saw male leaders, and I hope that we can serve in that capacity. With regards to this question, I absolutely agree with what Jill stated. And U.S. Soccer is a sport that, has all inclusivity, meaning genders, disabilities, abilities, and that's what I love about the game of soccer. I think some of our crises have all been touched upon, but I agree with, especially in our game, keeping young women in the game. The love of sport is never discussed enough. And it's something that we have to really advocate for at every level. I think we also have to look at the structures of health and safety in organizations and remove it from performance and remove it from areas of competitiveness and make sure that those safeguards are in place. When you look at the sport of soccer across the United States in the NCAA, it's the highest amount of either dropout, transfer. It shows that it's not successful, and it's something that has to be looked at. I'm also a father of a student athlete that is a soccer player at Johns Hopkins. So I've gone through that whole process. I've seen with my own eyes the inequities that exist in the game. It's something that fuels me and drives me. In regards to U.S. soccer, some of the things that we've done, when we talk about concussions, in the sport where the rest of the world doesn't see the U.S. as a leader or should have any place in the game of soccer, we were the leaders when we talked about restrictions in heading and even bringing that topic to play. And we did that nearly 7-8 years ago. And now what you're seeing is in the game in England and in Scotland and FIFA, they are now starting to have those conversations in regards to restricting and heading and protecting young athletes. And in that sense, the feeling is if you protect young athletes at a young age, they're going to continue to play the game. They're not going to be fearful of participating and having all the benefits of exercise. We've created a platform called Recognize to Recover, and I won't go into all the details, but within that is a outward facing platform for the sport that talks about mental health, that talks about CPR, that gives training in all of those areas. We directly educate and mandate training for our coaches and referees. I think it would be lost upon me to not speak about creating environments that coaches, parents advocate for young women in the game, and that those places are places of joy, fun, and safety. And we can go into that quite a bit. I think additionally, there's a gender bias sometimes from players looking at healthcare professionals that are females. We need to do a greater job of making sure that our athletes understand that women can take care of them, that they're the leaders in those areas. We have a huge amount of female physicians, athletic trainers, physical therapists, all in leading positions, and we're very, very proud of that. And lastly, what I would say is we're also the sport where we have a chief medical officer, both in MLS and now in NWSL, that are women that represent those senior leaderships. So those are some of the things that U.S. Soccer is doing, but we definitely have a lot more to do.
Thank you so much. Our next question. Can you comment on women of color in sports medicine fields and the unique challenges they may face? And we're going to start with Dr. Ward.
Thank you. I think we all can recognize that there is a lack of representation in terms of the sports medicine profession when it comes to African-American women. And that is something that definitely needs to be addressed. What are our young girls seeing when they go to the athletic trainer or they need surgery and they go to the doctor and they never see a reflection of themselves? So we need to make sure that the resources to pursue fields in sports medicine, such as athletic training, are available to African-American girls. We need to make sure that the healthcare professionals have cultural competency, that myths about pain sensation, blood clotting, things that laypersons and medical students, there was a famous study in 2016 that showed that there were so many myths about the Black patient, and that impacts the health history. It impacts how an injured athlete will be treated. It impacts trust, the trust that will be between the healthcare professional and the athlete. Because if that Black athlete has a negative a negative experience with that healthcare professional, it could affect them for the rest of their lives. We've seen negative health experiences with the entire COVID-19 experiences. We also need to make sure that we take into consideration the impact of structural racism, microaggression, generational trauma, all of those things, and many of my colleagues talked about mental health. All of those things are just for the average African-American female. Now add in competitive sports on top of that. And that is something that really needs to be taken into consideration. So with Black Women in Sports Foundation, we do have programming where we affirm our young ladies in elementary school throughout life. We talk to them about health. We talk to them about prevalence, incidence, mortality, those epidemiological terms. They seem big, but you know what? They're not all that big. We let them know early on. We talk to them about the musculature, the cardiorespiratory system, the skeletal system. We talk to them about their beautiful bodies so that they are not scared of them, and they also know that no one should abuse them. We also want to make sure that our older high school to college, pre-professional, we have programming for them as well. And we talk about stress management, we talk about chronic disease, we talk about all of those things, because when they are trying out for those jobs to be the head athletic director and the head athletic trainer, they need to be well. They need to be whole. And we need to make sure from the playground all the way up to the boardroom that they are prepared internally, because externally, many of them already know what's coming at them, and they will be better able to deal with those issues.
Thank you. Dr. Ireland?
Women drive the healthcare train, and I do think it's very important to reach our girls, to know that the girls can do so many things. They can get their generation of aunts, uncles out exercising, and I really think I've heard a lot of people on this panel talk about what they're doing in their local communities. So it would be nice for us to collaborate, but even more importantly, make an impact in your own community to make sure you reach out and let girls know they can. We have an initiative through the University of Kentucky College of Health Sciences, Active Women's Health Initiative. And so that's something I'm supporting. And having been blessed to be able to be a competitive athlete, I want to give it back and make our youth be better in so many ways. And this includes Black girls, underrepresented minority girls. We in orthopedics have a problem. Patients want to have their doctors look like them, and there are not enough orthopedic surgeons who are female, Black females, underrepresented minorities. And speaking from the AOS, there is a initiative, grants, that has just been launched this year, 5 million, 1 million over each year, in diversity, equity, access in orthopedics. So I do think that we orthopedists know there's a problem, but where do we get these young girls to go into orthopedics? And I think it's got to be middle school to have them speak up. We as physicians earn the trust of our student athletes. My door was opened at the University of Kentucky because the coaches and the athletic trainer helped me open those doors, and I have a career that would not be the same. So I think the door may not be open, but then that girl needs to be encouraged, or that team physician needs to be encouraged. How can you open the door or go around? So I think we need to emphasize that we are treating our student athletes equally, whether male, female, whatever their race is. And I think that we've made a lot of improvements in that, but we have to get underrepresented minorities, Black women in orthopedics. And how can we be better mentors, sponsors, help them be leaders? I think it's got to start early in their childhood to know that they can speak up, and they can't say they've been violated or whatever. And that's where we need to reach it, I think.
Thank you. Kristen?
Thank you. I had the opportunity to serve as the CEO under our first African-American president in 2020, Dr. Nicole Keith. And Dr. Nicole Keith, during her term, obviously was very committed to diversity, equity, and inclusion. She's also the essentially innovator of ACSM's diversity, equity, and inclusion program. I think, obviously, I'm not a female of color, but I think the biggest opportunity we hear the word anti-racist, and I think it's critical that we continue to live that. And as my job, or in my role, as not only, I'm not a healthcare provider, and I'm not a female of color, I am an ally, I am an advocate, and I am providing opportunities for those individuals, whether it's hiring them as staff members, whether it's getting them engaged as volunteer leaders, and really giving them the opportunity, as Dr. Ireland said from the beginning. I cannot walk in their shoes, but I can stand beside them and be an ally and advocate, and most importantly, anti-racist, to get individuals in the healthcare profession so that they have individuals that look like them and they feel comfortable. We have to do that. And the American College of Sports Medicine is doing that through our diversity programming. We still have a long way to go, but I think it's something we focus on every day. And we're lucky to have a leader that represents African-American females, and will continue to embrace that approach.
Thank you. Dr. Powell.
Yeah, thanks. I think that the whole goal, and I think people have referenced this, is to have athletes have providers that look like them. And I was just thinking about leadership in AMSSM right now, since I'm here speaking about AMSSM. I think that it's important to know that African-American sports medicine team physicians are super valuable to their athletes. We currently have 25% of our board represented by African-American men and women, and hope to increase that. It's overrepresented among our overall membership, which is great. That's the best thing in the world. I just also wanted to mention grant opportunities that AMSSM has provided. I think Dr. Ireland alluded to this as well. We want to improve the pipeline. Like, we need students of color to consider medicine, and then sports medicine or orthopedics, and kind of really intentionally create that pipeline. So AMSSM has a grant for medical students designed to basically go into their communities in the elementary, junior high age group to try to really encourage STEM, develop interest in sports medicine, with the hope of recruiting kids who hopefully come from underserved backgrounds, underrepresented minorities, people that will then go into their communities and, again, look more like the athletes that we're all taking care of. I agree with Kristen, and thank you so much. I am also not a woman of color, obviously. I'm an ally, and I think that that's a really important role as well. So I also can't walk in those shoes, but can walk aside. And I think our role as leaders is, again, to improve the pipeline and support those that have had inadequate access to opportunities in the past, in spite of Title IX.
Thank you. Dr. Rodriguez-Regner.
Yes, thank you. So as a Latina in sports and sports medicine, and also national leadership roles, I believe that being Latina has really helped me bring awareness and diversity and a different perspective to all that I have been involved in. A lot of great ideas have been brought up by the speakers previously to say we need to start earlier with the education, the resources for our females. And I believe with the different organizations I've been involved in, we've been able to really go back to when they were elementary students, when they were middle school students, to say, I'm a woman in medicine. This is one area as a physician that you could be when you grow up. Like all of us have learned through repetition, perhaps this is the perspective that we take, is that it's that repetitive exposure to women in medicine, women in leadership roles, that can really make a strong impact and inspire the youth and keep that going and that exposure all the way through middle school, high school, when they get into college. That helps to build our future. Being a Latina in medicine, you know, that's one of the reasons I was able to help out with the President's Council for Sports, Fitness, and Nutrition under our past president, Barack Obama. They were really looking for some diversity within the President's Council, and it was amazing to be part of that experience and really share the vision that everybody had. I think we need to do a better job of just having that consistency and really reaching out into the community from elementary schools all the way up to college level. I think organizations do a good job in healthcare about really tackling the medical students early on with clubs, and there's different diversity committees that now medical schools and even our national organizations are developing, but I really need to start earlier. This past year, as president of the AOASM, I was proud to start also the diversity committee. So this was really important in our organization because, again, as our female students, residents, and fellows are increasing in sports medicine, we want to provide the membership opportunities, the lectures, the meetup groups that are really going to provide great discussion and just foster diversity within the organization. So overall, I think the unique challenge our organization does continue to face is, again, just reaching out earlier and giving those resources so that we can inspire and bring more women of color into all three roles.
Thank you. And LeGwen.
Thanks, Kathy. I'm building on what the panelists have already said, both as allies and women of color. And I'm speaking to you based on my experiences as a Black woman who served as an athletic trainer for a little more than 24 years on a college campus. NC2A has a little more than 1,100 member schools. And if you look at the data, at those 1,100 schools, there are about 4% Black women that serve as an assistant or associate athletic trainer. If you look at head athletic trainers, there's only 2%. That's 24 Black women. I was recruited by a Black woman, head coach, Beverly Kearney, right out of college, no experience at a major D1 institution. And she did that because she understood the importance of having a diverse staff representing all of the different individuals that made up her team. And it wasn't just her mentality, that was the mentality of the women's athletics department, from the athletics director, Jody Conrad, to one of our own NATA Hall of Famer, Tina Bonsi. They brought me in, they nurtured me, they created opportunities for mentorship, they developed my professional growth and helped to cultivate me as an athletic trainer, which allowed me to rise in the ranks to the position that I'm in now. My story is not the norm. We're in 2022 and we're still talking about being the first Black woman in a role or being the only Black woman on a staff. One of the unique challenges that we face as Black women in this profession is taking on that added pressure of understanding our success and failures impact the opportunity of Black women coming behind us. I think as individuals in decision-making positions, it's important that those individuals seek out qualified minority candidates, but not only that, create in that environment the systems that will support them and lead to their success in the roles that they have.
Thank you, LeGwen. So we're getting short on time, but this next question is so important. I still want to ask it. and ask that our answers are succinct and quick, as quick as you can. We certainly realized progress over the last several years. However, I think we can all agree that there's still more work to do. There is still gender gaps, especially when it comes to compensation for women. We see this not just in sport, but in every sector of our professions. How can we continue to close this gender pay gap? Dr. Labatz.
Sure. So, I trained in pediatrics, which historically is the medical specialty with the highest numbers of women and the lowest rates of pay. And the question always was, does this reflect the value that we place on care provided to children, or does it reflect care provided by women? And unfortunately, it appears that the latter is maybe more true than we would think. A couple of months ago, there was an article published in JAMA Network that showed that even from the very beginning across medical specialties, females, for reasons that are unclear, our starting salaries are 10% less than our male peers, and that is true right out of training. In addition, we're promoted at slower rates, our salaries increase at slower rates. That probably has something to do with the way we practice medicine in the office. We spend longer time with patients, we spend more time doing less compensated procedures. As well as the demands for our time to provide care outside the office, right? You can't escape the biology of childbirth and pregnancy, but the longer term demands on our time in terms of caring for children, caring for aging patients, those are disproportionately borne by women. And so, to change that, right, you change the policies, that's kind of making equal opportunities for family leave, et cetera, available to all. But I think one of the most troubling things that I've seen is even in programs where they've changed the policy, discrimination is still acutely felt. And not only gender discrimination, but even maternal discrimination for those women who've chosen to have families during the period of training and in their early careers. And so I love that the concept of kind of the allies where, not only kind of helping to provide opportunities for females, but also kind of trying to change the ecology where females who are taking advantage of maternal and family leave policies, they're not subject to discrimination, and there's a greater level of understanding among their peers. So I think that's going to be the biggest change, right? You got to have the policies and stuff, but we also have to change our mindset within the profession as well.
Thank you. Dr. Orozco?
Yeah, so I'm listening to everybody. My mind is spinning on how many things I can talk about. And all of this is resonating with me. I'm a single mom of 3 children. I'm a woman in healthcare. I work in vascular surgery for the last 20 years, which surgical subspecialties for women are, just non-existent. We're improving, but we're not gaining ground. And I'm also still a competitive athlete. So I want to talk about 2 things. Because I think once you're an athlete, you're always an athlete. So I'm a gymnast turned competitive cyclist. And not too long ago, I decided to look up, maybe if I became a pro cyclist, this would become my full-time gig, right? And I looked up the pay, and the top male pro cyclist in the world makes $5 million. And the top pro female cyclist in the world makes $150,000. And that was shocking and overwhelming to me. And I was like, well, forget that plan. I guess I can't do that. But what it made me think was, well, wait, let me go back and look at my own profession. And there's a lot of data, JAMA in 2013 really took a look at all different healthcare professions and, adjusted for different factors. Factors that Dr. Labatz was just speaking to, which was hours, specialty, what have you in terms of healthcare. And I thought, well, why are we adjusting for factors? Like that's part of the issue that we have is, when you look at where we are in 2013, which was tremendous, we had a 30% gap disparity in the PA, which was also the time that the PA profession tipped to become predominantly female. Now, we are a predominantly female profession. Over 72% are female as PAs. But we still have a gender gap of a wage gap of 7%. And at the end of the day, it's just unacceptable to have a gap at all. And so what can we do? And I think again, going back to that community focus, I'm part in my own organization of the Women's Leadership Council. It's about women elevating women elevating not just women, but women of color, underrepresented minorities, all of those things that we need to continue to do. We have to have holistic approaches to compensation. We inquire about people's wages prior to coming on board. We have managers making decisions, and there's implicit bias and some other things that still exist when it comes to how much someone's going to get paid or how much I'm going to give somebody, whether it's intentional or not intentional. Those are the things that we have to work on. We have to work on publications and transparency, talking about what is the CEO of the organization paid if it's a female versus a male, and those are things that we have to start discussing and really talking about transparently if we want to make a difference. But I firmly believe strongly in about women elevating women. I know I try to do that from a personal perspective, whether that's as president and chair of the board, whether that's in my own role in my own institution. But I think for all of us, that is the way and the path forward, is how do I take the next person behind me from, middle school all the way up to, mentoring other women in medicine and push them forward, because I want them to break through that glass ceiling. So there is no glass ceiling anymore. So thank you.
Thank you, Dr. Schneider.
Yes, thank you again for this. Is a great question. So emergency physicians are in very much in part paid by the hour. Many of us are paid by the hour, and we do very similar work when we're on the floor working clinically, and we see the same number of patients. So all things should be equal, and yet there still is a gender pay gap. And so it's hard to figure it out. But I reflected back to when I was chair of the department at the University of Rochester, and I came in as the new chair. As the founding chair. So I got to hire the faculty and set their wages, etc. And I was very careful. Women were going to be paid exactly the same as men. That was going to be my mantra. And a few years later, I looked at the pays and I realized that the men were getting paid more than the women. And how did that happen? And I reflected on it. And two things: men came in and negotiated, and men came in and asked. And women did neither of those things. We simply don't know. We're afraid to negotiate. We're afraid to ask. I reflected back on my own career. There was a man that was hired at the same position at a hospital adjacent to mine, and I in the Department of Emergency Medicine. At that point, I guess we were the Division of Emergency Medicine. At that point, it was like 3 people. So it wasn't a lot of competition. And he kept getting all these gigs. He would get these times to talk. He would be presenting at meetings. He would be doing papers. And one day I was standing next to him when the chief was there, and he said, "Hey, I noticed that such and such a meeting's coming up. Do you think you can get me a speaking slot?" And the guy said, "Sure." And I went, "Really? That's how it happened?" So I said, "Hey, do you think I could get a speaking spot?" And he goes, "Sure." And I'm like, "That's it? That's what I was missing. I forgot to ask." So I think empowering women to two things: empowering women and telling them they need to ask. And it's okay if somebody says no. It's not a big deal. They need to negotiate for their salary instead of taking the first salary offered, and they need to know how to do that. And it's okay if they don't get it. It's not a big deal. It's not like everybody's going to hate them. And then I think we need to work with our people who are setting these salaries and dealing with promotions, and say to them, you need to be very transparent, and you need to really make sure that when you're taking somebody and moving them up for promotion, it's not just because of that. And then one other thing, and that is increasingly, I have a lot of women coming to me saying, I'm really worried that my career is going to be a negative effect on my children. I'm really worried. I'm sick that my kid's going to turn out bad. Well, let me just tell you, from the women that I know of my age who all have children and my own child, I mean, they turn out really well. I mean, maybe even better. So don't be worried.
Thank you. Dr. Tyne Nissenbaum.
Sure, I'll keep this brief because I know there's so much more we want to discuss today. So the profession of physical therapy is predominantly women. 65% of physical therapists are female. About 71% of physical therapy assistants are female. Yet we too, like the other professions that discussed this, also see a pay gap of about 10%. So I agree, or I'd like to echo what everyone else has previously said. I think transparency is incredibly important. I think knowing what the salary and importantly benefits package is, looking at the entire package and the cost of the whole package when seeking employment is very important. I also think getting that information early in the interview process is also very important. Why do we go through this whole interview process? And then that's the very last thing we discuss. And we realize that the salary is exceedingly low. And I know this is something that's been mentioned on the Den quite a bit with NATA. So I think transparency, I think talking salary and benefits early is important. And then I think a very set professional development ladder that is completely objective needs to be set in place for future growth and development. And I love the point about advocating for salary negotiation. I think that's fantastic.
Thank you. Dr. Champus?
So I obviously represent a sport that hopefully has created an inflection point, been part of negotiations, CBA negotiations for many years. On a lot of different topics in the sport of soccer, and most recently making sure that the pay is equitable. I think that is a huge step. It's a first step. I think other sports, leagues need to look at themselves and step up, and we'll see what the future holds. But I'm proud of what U.S. Soccer has done. We have not necessarily done everything right in the last 7-8 years. Proud that our president, Cindy Parlow-Cone, advanced this, and excited about the future of women's compensation. In regards to compensation on the healthcare side, I think it's critically important that you have leaders that understand who they're hiring and the work that they're hiring them for. We don't see that necessarily. In hospitals, we have administrators that are not clinicians. They're not healthcare workers. They have no clue, quite frankly, what it means to work in a clinical setting. I work as a team physician for many years across the NCAA with athletic trainers. I've seen and lived the amount of hours that they work. I get the texts at 5 a.m. and at 11:30 p.m. And so you need those people to set the pay for those individuals. That is something that we can no longer tolerate, is that you have general managers, sporting directors that are paying healthcare providers. They don't have the capacity. They're incapable to be able to make those pay rates. And so you need like-minded individuals that respect and understand the roles that it requires to serve the athlete, as well as the number of personnel that is required. We see in the NCAA that we do not have the number of athletic trainers. We could talk about mental health till we're blue in the face, but when a program has 23 teams and they have 11 athletic trainers, we're not doing any justice for that. So lastly, I'll say is that U.S. Soccer, from a compensation perspective, we've gone through a thorough review. There is absolutely a strict guidance of equal pay for our healthcare workers. And again, when you have the leaders in place to meet that, that's when you set that expectation and it's met.
Thank you so much. Sarah?
Thank you. I echo so much of what has already been said, but I think sports really can be a microcosm of society, and so much of what has been discussed already, I think can be, is seen in the sports space. And I'm hopeful that the U.S. women's national team push for equal pay, we're already seeing it resonate among other sports and other sports pushing for equity for their women athletes. And I'm hopeful that it'll help set a pace of change for society more broadly, just as we saw, Billie Jean King's match with Bobby Riggs in '73 really was an inflection point for society and women going in the next day and asking for a raise. So, using our athletes as role models and making sure that we can elevate those big discussions around equal pay and equal treatment, and leveraging that for women more broadly in all sectors of society, I think is really, really crucial and really important. And the other thing that I'll say, echoing what's already been said, is really just those in positions of power making a real cognizant and deliberate effort to examine what is happening, in your own house, and making sure that you are adjusting for any discrepancies that may exist, and encouraging the women around you to ask for more and ask for pay raises and do that negotiating really, I think, are two very important points.
Thank you so much. We do have other questions, but we're running out of time, and we do want to share the survey results. So we're going to jump to that and unveil the results of the survey that were sent to many of these organizations. The survey was open from May 19th to June 6th, and our participating organizations were the American College of Emergency Physicians, the American Medical Society for Sports Medicine, the American Osteopathic Academy of Sports Medicine, the American Orthopedic Society for Sports Medicine, the American Physical Therapy Association, the Black Women in Sport Foundation, the National Athletic Trainers Association, and U.S. Soccer. We had 2,000 total participants, with the predominant industries being athletic trainers, physical therapists, and physicians. The largest generational group responding was millennials, followed by Gen X, baby boomers, and Gen Z. The racial breakdown was predominantly white, followed by African American, Latino, and Asian. The LGBTQ plus community was represented in 13% of our respondents. Overwhelmingly, 96% respondents played in organized youth sports. 12 statements specific to equity, opportunity, and balance were posed in the survey. The majority of respondents somewhat agreed with the statements. This seems to indicate, given this initial survey, that although progress has been made, there is ample room for improvement. When asked how Title IX has impacted the respondents, the most positive impacts came in opportunity, sports, scholarship, and career. The least positive impacts fell within legal, work-life balance, and salary. Oh, I'm off. Got it. Title IX role models included Billie Jean King, Pat Summitt, the U.S. women's soccer team, coaches, and family members. In conclusion, the respondents showed positivity regarding equity and opportunity within their industries and in the future. Ooh, I'm so sorry. Once again, it's obvious from this survey that progress has been made, but more is needed. Our plan is to revisit the survey in 5 years to measure these numbers again. We do have details from each organization who participated in the study with what's going on in their particular organization. But I want to transition to any questions that may be out there as we are running out of time.
I just have a question. My name is Margaret Hunt from Westchester University. Going back to mental health in the aspect, I know women and girls are more predominantly going to say they have a mental health problem. I was just wondering, with the barriers being, we've mainly talked about like education and stigmatization, like what other barriers do you see, and how we as women in the mental health or in the healthcare system can be better facilitators towards that?
I'm going to throw it out to anyone on the panel who would like to answer. Dr. Schneider.
I just want to mention, as physicians, we face a significant barrier. There are still places that ask if we've had any mental health issues when we get our licenses or when we get credentialed with hospitals. And that we're certainly, I think all of medicine is trying to do away with that type of barrier. The other thing is there was just a act passed in Congress called the Lorna Breen Act, which talks about which talks about the ability for healthcare workers to seek mental health. This act was particularly poignant to me because Lorna was a friend. She's a fellow emergency physician from New York. I'm sorry.
If I could
That
take
was
that
past
question
tense.
also.
She was.
Yeah. If I could take that question also, because I think it's an important one. And I think one of the things that's, I think, most concerning is that we have a major workforce shortage in healthcare. Physician, nursing, providers, and anywhere there's a workforce shortage right now. Part of the fallout from the pandemic, this was pre-pandemic, but now even post-pandemic, it's even worse. We had 500,000 healthcare workforce leave in 2020. And so this is going to persist. So I think it's really important that, and I know this is something that our organization is focusing on, how do we get, how do we reach everybody, right? Because access is a major problem. So I think, one of the things that I know we're trying to do with this Kick the Stigma campaign is you can give some basic mental health first aid training to everyone, no matter, just mom or dad can have the same training so that they can recognize these issues and point people in the direction that they need to be. Just listening to your patients, even if I work in vascular surgery, but just listening and hearing what patients have to say is really, really important as we move forward. So I think the more we can improve this access and really kind of develop this pipeline to all of us recognize mental health, no matter what your specialty or your area or your profession, is going to be really important as we move forward if we want to make a difference in this space.
Thank you.
Hi, I'm Jennifer McKeon from Ithaca College. Excuse me. I'd like to thank Kathy and all the panelists for the discussion. It was extremely interesting and well needed. I, like many of the people, completed the survey. Probably a lot of people in this room. We all have an interest. What are some of the actionable items coming from the data that you collected? What do you see moving forward from that? Because it's compelling data, but where next?
It's a great question. The data is going to be shared with the organizations, so they have the information as well. And our plan is to look at the data even more closely than we have and do exactly what you're suggesting, is look at what next, what's our strategic plan moving forward to address some of these inequities that the data is showing. We haven't gotten there yet, but that is next steps especially after this event. Thank you for the question. All right, well, this concludes our formal program today. We hope you found this discussion and survey highlights as compelling as we have. All of us on this panel share a collective commitment to Title IX, the benefits it's afforded, the doors it has opened, and the work that's still to be done. Our discussion doesn't end today. We'll continue to explore ways to even the gender gap, to increase opportunity for all women and on and off the playing field, and in healthcare especially, as we celebrate our successes along the way. I appreciate all of you being here today. On behalf of the National Athletic Trainers Association and all of our leading allied health associations, our colleagues on the panel, thank you for joining us. Have a great rest of your conference. Thank you. We